Okay.
Hi, Liz. Thanks for talking to me today. But what I would like to do is just continue the conversation on women's experience with cancer.
Right. Right.
And so tell me a little bit about your experience. How did you come to go to see a healthcare professional, and how did you come to a diagnosis of cancer?
Right. So I've got to like dust off my notes. It's been a while. So I'm lucky to say that I'm actually nearing the 20-year cancer survival mark, which is kind of crazy to just say because I'm 42 now, but I was diagnosed with cancer when I was 24. Um, so in terms of how it came about, I had been having spotting quite a bit um, with my cycles, and to a point where it was starting to get more and more, and I felt like something was wrong. So I went to my gynecologist, and I said, I was lucky enough to have a gynecologist, which isn't always the case nowadays. And uh, she said to me, well, we just did a PAP in, whatever, whenever it was. You had one done recently enough that we don't need to run one again. It's probably just your birth control. So we'll change your birth control pill and see if that fixes the problem. So I went away for she said, "Well, I'll see you again in 3 months." So I went away, changed the birth control pill, but the spotting continued. It actually started getting worse. I started to get some pain. So I went back and she said, "Well, your PAP was fine, so we don't need to do that. Why don't I change your birth control pill again?" And I was like, "You know what? I feel like this isn't normal and something's wrong. So can we please just do a PAP again? And I'll also change the birth control pill and see if that helps." And she was like, "Okay, well, we'll do another PAP." And so off I went with my birth control, thinking like that's probably going to clear it up, but we just did a PAP just in case to be sure, right? Like no one ever thinks they're going to end up with cancer. No one thinks they're going to be in that side of the stats, right? So sure enough, I think it was less than 2 weeks later, I got a call from her office saying that the results of the PAP had come back and they were highly suspicious, and I needed to go and see a specialist at like a gynecology clinic near me for follow-up testing. And so I was like, okay, all right. I had no, I honestly wasn't even worried about it. Like they were like highly suspicious, but no one was talking about HPV then. No one was talking about cervical cancer, right? It was 2007. And it wasn't part of the dialogue in healthcare offices like it is now, and with health professionals. They're talking about HPV, they're talking about vaccinations, at least more than they were. So off I shuffled to the clinic thinking, okay, like maybe it's highly suspicious, probably just means like maybe I have endometriosis, or like it wasn't cervical cancer and HPV were not on my radar at all. So off I shuffled to the clinic, and I get in there, and they do an exam, and I'm kind of like I'm nervous, but because they're not really talking a lot, and it's the nurse, it's the doctor. I really have very little experience in the healthcare system at this point, and I just think of myself as such a baby then now, and wham, we finish the exam, we sit down, or like I sit up in the chair, I've still got my gown on, I've still got like like the blanket on me and everything. I just sit up in the chair, and he says, "Okay, so I'm just gonna get something up on the screen here," and all of a sudden there's big TV screen, and he puts my cervix on the screen, and all I can think in my head, my 24-year-old head was like, "Oh, I should have gotten a bikini wax before this." Like that's actually what I thought, which is, just tells you about my frame of mind. Like I'm thinking, "Oh my gosh." I whip around to make sure like the door is closed, right? Because it's like has anyone seen this? Like I don't, anyways. And then he points to this little white sort of spot on, and I've never actually, I think maybe like, I don't know that I had actually seen my cervix before, certainly not like that. Like I was 24, like, you don't anyways, and especially like, obviously the speculum was in and they were doing the test and everything. So like I saw everything and there is a white sort of scaly spot on my cervix, and he's like, and that's where we think the cancer is. And like it was like a mic drop moment for me. That was the moment everything changed because, and then I was like, what are you talking about? Cancer? Like, are you serious? Like I'm only 24. What, this doesn't even make sense. And he's like, well, it's from a virus. Usually it's from a virus called HPV. And I was like, what? You can get cancer from having sex? Like what? Like I've been so careful. Like this doesn't make sense. And he's like, well, actually it's very common. Not a lot of people know about it. And now there's actually a vaccine for it. I was like, thank you. That's fantastic news. And so what we're going to do is we're going to do, they took a sample, which, was a much more painful thing that I thought. I would have taken some Tylenol and Advil before the appointment had I known how uncomfortable that would be. But obviously it makes sense. It was so uncomfortable. There was cancer growing there. And, I was going to go on for a cone biopsy to see, how invasive the tumor was. So that was definitely an appointment that changed my life. And I walked into it being very naive about what I was actually walking into it for. So, yeah, that was sort of my experience of getting diagnosed with cancer. From there, I went on to have a cone biopsy, which came back saying, it was an invasive cancer, and I would need a surgery. And I had two options, either a hysterectomy or a tricholectomy, which means they just remove your cervix. I went for the tricholectomy because I did want to really have children. And when those results came back from removing most of the cervix, it was like, this is a very aggressive type of cancer. We need to do chemo and radiation as well. So even though, I had done the tricholectomy, it wasn't enough. So I ended up not, being able to have a pregnancy anyways. But I was lucky enough to be able to say that I, survived cancer. There's, I celebrate that all the time. And, I'm here. I was able to have a daughter through the gifts of egg donation and surrogacy, and she's 12 and she's amazing. But, I live with a lot of issues related to my treatment. And those issues, you know, are kind of like, as they happen, I discover them, but there was no, well, there was, chemo and radiation are probably going to put you into menopause. Well, okay, so I'm in week 1 of chemo and radiation, and all of a sudden I'm like, so hot. And I'm like one of those people that usually I touch someone and they're like, "Oh my God, you're so cold," right? And I was like just like sweating up a storm. And my radiation oncologist was like, "Oh, well, it doesn't usually happen that quickly, but I'll run a blood panel." He ran it and he's like, "Oh yeah, you're in menopause." And I'm like, why was I not like, there was just like, so it was like, it was just, I was shocked at how little warning I got about some of the symptoms and some of the changes that would happen with my body because of the treatment that I had. And that's just one example. But, I really, really felt that there was a lot of, it was a very harsh lesson in how our healthcare system is meant to treat acute problems and not, designed to help people live better quality lives
Mhm.
or more healthy lives, or even, post cancer or post whatever disease someone has, how to manage that and how to manage the symptoms and what might come up. Those patient roadmaps just simply do not exist in our healthcare system. And when you are a post any type of patient, you really do the security, knowing what your potential symptoms can be and your potential post-disease issues could be is vitally important for how you plan and live your life, right?
Yeah.
So
And
I
probably
really,
really important for women as well, because like for you, you were, and like going through that surgical menopause. And so like having that information would have been useful.
Yeah, yeah. So for me, it actually wasn't surgical menopause because I still had my ovaries. It's just the radiation and the chemotherapy were causing them to shut down,
Yeah,
right?
exactly.
So, so, and menopause is a whole thing, right? Like it's not like I just went off and it was like, okay, now I am in menopause and I'm going to live the rest of my life and I don't have to do anything medically to manage that medical condition, right? If I
Exactly.
were to just ignore the fact that I had menopause, there would have been incredibly difficult side effects that I would have to deal with day to day. And there still are side effects, but managing menopause is vital for any woman, but especially a woman who's 24 years old when she goes through menopause, right? Like, had I not sought out hormone therapy and certain supplements and, ensuring that my hormone therapy was appropriately managed, I would be at risk for many things, like heart disease, as an example, earlier dementia, bone density issues. Not to mention, not having a sex drive or,
Yes.
just not feeling like you're supposed to feel as a woman and
At
all of those
24.
at 24, right? And all of those options were not, you know, I got referred to a gynecologist who was like, okay, well, here are some estrogen patches, here are some progesterone pills, and you need to take calcium and vitamin D. Well, that's, good, but at the same time, it certainly set me on the right path. And I had her access to her for about a year before, she was like, okay, that patient's now managed. Moving
Yeah.
on, right? And it's not like those are the solutions that are going to work for the next 60 years of your life, right? So, you're kind of left out there a little bit in the dark, and you're managed by the cancer center for 5 years after you graduate, and then you just get referred back to your GP. Luckily, I have an amazing GP that not everyone has, because my gynecologist also retired, and my GP's been really great for helping me manage a lot of my symptoms and really just um yeah, understanding where I'm at, and understanding that my health is unique and that I need a different level of care than her other female patients, and a different,
Mm.
um, you know, level of, it's not like most other 42-year-olds are just going in there to talk about maybe how they're feeling hot and cold or not sleeping well or whatever, or even, I mean, up to 50, really, right? I'm like, I have friends right now who are starting to like go through this change, and I'm like, oh, sit, let's talk, because I'm going to tell you a whole bunch of things that you need to know about right now so that you can live a good life after, during and after menopause. But it's really interesting, how much how our system is just really meant to manage acute problems, pressing problems that are going to stop you from living life. But everything after that, in terms of quality of life, you need to be proactive about your health.
Yeah.
And
Because
it's
you're
just
on
a
your own at that
lesson.
point.
Yeah, you really are. You are. And like sometimes you'll find friends along the way or people that can really help you, like I managed to with my GP and some other doctors. But you do have to become an informed person and manage your own healthcare, and become, it's almost like that's your job before your job, right?
Yeah.
Is managing your health. And if you think that it's going to be spoon-fed to you, it's not. This is
Yeah.
not how our healthcare system works. You need to be proactive. You need to seek out options. You need to become educated on whatever medical conditions you have, and you need to make sure that you're getting the resources you need. And no one's going to do that for you. So you
Yeah.
do have to become proactive. And I think that's a really important message for all women at any age, all patients really. But I come at this as a woman's health advocate, and women are a bit timid when it comes to managing their healthcare, and they really feel that, I don't know, almost like they're bothering their doctor, or they're causing issues just by bringing up concerns, or making an appointment. They feel like, oh, well, I don't want to waste my doctor's time with this, I'll just ask at the next appointment. If I did that, I wouldn't be here right now.
Yeah.
So I think it goes to show you that, you know I'm going to quote my mom, and she would love this, to know I was quoting her on a podcast, but the squeaky wheel gets the oil. And if you're not telling people what is going on with your body and going to medical professionals and advocating for the things that you know are not right in your body, then you are most certainly at some point going to run into an issue that goes too far.
Yeah, so I feel like most of us who are at that age now where we're like transitioning into, like we're in the perimenopause and we're transitioning into menopause or in menopause, and
Mhm.
like we've grown up, like we didn't have the computers and the internet and all that growing up,
Yeah,
but I think we're a
yeah,
lot more comfortable, but maybe not everybody is super comfortable like advocating for themselves. So, I mean, you
yeah.
talked about how you need to do that because nobody's going to do it for you. So, like what do you suggest for the people who are, and even for the people who are a little bit, who don't want to bother their healthcare professionals, like what do you suggest for these people who are maybe not so technologically inclined? They don't want to Google, they don't want to know, they just, go into their doctor's office and are going to do whatever their doctor says, but who are struggling in the background.
Right. Yeah. Like, I mean, I think it comes down to, I alluded to earlier about the idea of managing your healthcare like it's your job.
Mm.
And, in a lot of work settings, you um, are are you're if you're having a meeting with someone, if you're going to actually, I'm going to apply it to this. So let's say you are, you know, you go to your doctor's appointment and you're in there and your doctor starts off by saying, "How are you?" And you say, "I'm good." And let's say you're having some sort of an issue and they say, "Oh, well, that's probably nothing. That's probably just this." And you feel like maybe it's not just this. Like maybe it's bigger than that, and you're not really satisfied with the doctor's response. Do you leave the appointment and let the issue persist and then make another appointment? Or at that appointment, do you say, well, is there anything we can do to assess it? Is there any way we can take it to the next phase right now? Like, is there a test I could do? Is there a specialist in this area? Because if you're having those conversations, like then you're taking that step to manage your healthcare, right? And let's face it, our healthcare system is you know the gatekeepers are the doctors, right? So developing a good rapport with your doctor and having them understand that you're not a patient who's going to sit on an issue you're having is a really important boundary to establish, and to make sure that if they say to you, okay, well, let's see if it's still going on in a month from now. When you're leaving that office, you book an appointment for a month from now. You can cancel that appointment, but put that appointment on the book so that issue is not going to persist. Because if you leave it for another 3 months, if I had left my issue for another 3 months, I don't know if I would be here right now. And I
Yeah.
think that's a really important thing. And I'm talking about something that turned into cancer, but there's situations where it could be a condition that could be easily managed. Maybe you're having um, you know, you know, issues sleeping at night or feeling hot and cold. Maybe you're having a thyroid issue, but maybe you have thyroid cancer. You just don't know, right? But you know that if you get that testing done, it's going to give you more insight. So
Mhm.
sitting on an issue rather than getting it assessed when it's actually affecting your quality of life is not a good thing. And, we do pay taxes into our healthcare system. Yes, it is overstretched, but everyone deserves the medical care they need. And so, being assertive and saying to your physician that you need a certain test and that you would like it is not the wrong thing to do. And I think a lot of women, especially, tend to feel like they're being pushy and it's not an acceptable thing to do. And it certainly is.
Yeah, I think that's really a really important message to drive because even for myself, like, and I'm educated and I know what the healthcare system is like, and that's what I
Mhm.
meant by educated, not that I was smarter than everybody, but
No, no,
like
no, no, no. I know.
I
I knew what
I
you meant.
understand what the healthcare system works how the healthcare system works. And I find that when I go see my family doctor, like I don't push, and I think part of it is because like I know it's not cancer and I'm taking up like valuable resources from other people who might need her more than I need her, but I
Mm-hmm.
am suffering quietly in the background. So I think that that's a really important message to drive.
Yeah.
Uh, And I think the other thing, like for me, and I'm like thinking, like, I think you said 2007, as a 24-year-old walking into your office, into your doctor's office, and insisting that you needed to have your pap test redone. I find that like how, like, what was happening in your brain for you to say, I need to get another pap test? And I know it was a while ago, so you might not remember, but I'm
No, I
just like,
do though. I do. I just had this at the same time, like I was one of those people that really wanted like glass half full. It's probably gonna be fine. And that's how you feel, but I feel like you feel like that as a 20-year-old all the time. Like everything in the world's gonna be fine. Like you feel like you have this superhuman ability to live forever when you're in your 20s. Like,
yeah,
but I just had this like, what if it's not feeling? And I just had a bad feeling and I I didn't believe it was going to happen, but it was just this little tiny voice inside of me saying like, what if something's not right? And I knew none of my friends were having the symptoms that I was having. And I, you know, I just I feel like I had this voice inside of me saying something's not right. I didn't want to listen to it, but I was like, well, I'm just going to listen to it and get the testing done so I know everything's fine. And it wasn't fine.
yeah,
So that's to me is like whenever and now whenever I have that voice, I'm like run to my doctors, right? Like I'm like I just I we need to listen to ourselves. And even when you think the voice is probably wrong, our medical system is there for you to find out the answer to that. And
yeah,
ignoring that little voice, I think not always, not often, but in some situations can cost you your life.
yeah. And like it just goes back to like, that expression of trusting your gut. Like there's a
Yeah.
reason they tell you to trust your gut, and you're gonna
Mhm.
feel it when something is not right, and you'll probably
100%.
feel it in your gut. But
100%. And like and that's with anything. Like you see a mole, you feel a lump in your breast or somewhere in your stomach or and any like these are things that don't necessarily mean something, but our medical system is there to find out if they mean something.
yeah,
Our bodies grow things, unfortunately, that are uh, and bumps and lumps and things like that. And most of the time they're nothing, but sometimes they are something. And if you remove them early enough, if there's earlier intervention, outcomes are much, much better than if you let something linger and continue to have issues, right?
yeah,
And it goes for men as well. Like I've heard stories about, men having symptoms and I know I run around and I get my husband to go to the doctor for things where he's like, no, it's probably fine. I'm like, nope, you're making an appointment to go to the doctor because you just don't know. And that's what our doctors are there for, right? We pay our taxes into a medical system that is supposed to work for us. And there are shortcomings in it. There are, it's certainly in a difficult, you know, phase of itself right now, but it is meant to be there to utilize for things like this. So, be assertive, manage your healthcare, and don't take your health for granted, right? It's not a given.
yeah. And I also want to go back to, you were talking about how, like nobody was helping you transition. And I think, like, okay, maybe I want to make this like a two-part question, because I feel like when women go see their doctors, it's like it's always about our periods. And it's like, oh, it's nothing. It's, related to your
Mhm,
menstrual cycle or whatever.
mhm,
And
mhm.
it isn't always. And then the second part of that is, they're always blaming it on the menstrual cycle, but then they're not really offering any help, like whatever the issue is, and even if it
Yeah,
is about the menstrual
yeah.
cycle.
I think a good rule of thumb, and what I would recommend to any woman I'm talking to, is if you're going back for a second appointment, and at that second appointment, if the physician is not solving the problem, you should be asking for a referral to a specialist. Because after that, you've given them one chance to treat something that's impacting your quality of life. And then you go back a second time, and if they still don't have a solution for you that seems like like a likely solution or a path that you feel is going to be effective, then you should ask for a referral to a specialist. And if they are not willing to give you one, you can go to a walk-in clinic and you can get one, or you can do one of those virtual clinics and do a, you know, you can pay a fee and get a referral, or whatever is the right decision for the individual patient. There are ways to get referrals to specialists without going through the one doctor that said no. So it's not like they're the gatekeeper of the entire healthcare system. There's other ways to get referrals to specialists, and sometimes doctors are not right. Sometimes they are not, you know, just like any human, they can make mistakes, they can misdiagnose something. So just don't believe that your doctor is the only way for you to be able to access care or get the right answers. There's some doctors that might not be as familiar with certain conditions. There's some doctors that, might not understand women's reproductive health as well as others, especially when you're in general practitioner areas, right? Like you're basically a jack of all trades. You're knowing a little bit about every field. And that's why they refer out to specialists when conditions are more serious or persist, because they don't always have the answers. So know that your doctor doesn't know all about all medicine everywhere.
Yeah.
They and there's other specialists who know certain areas better. And if you're not getting your answer from them or some sort of a treatment plan that you feel is going to be effective after your second appointment, then that's your time to ask for a referral or find another channel to get a referral to a specialist.
Yeah. And sometimes like even issues within your menstrual cycle doesn't mean that it's an issue within like your sexual or reproductive health. And women's health isn't just sexual and reproductive health, and it
Yeah.
encompasses like the whole body.
It's
So
the whole body. Yeah, absolutely. Absolutely.
I think that also is really important message to drive home what you were saying about your general practitioner, your family doctor, like is the gatekeeper, but is not the know all of all health
Mhm.
conditions. And
Mhm.
actually, they know very little about like specific things. I mean,
Yeah,
they
a
know a
hundred
lot, but they don't
percent.
know. Yeah.
100%. Yeah. And that's where we need to, let's say there's a specialty as an example, like, I'll talk about fertility because I know it. There's general practitioners refer to fertility centers when, their patients are not able to conceive because they aren't able to give the same extensive knowledge and use the tests in the same way to determine what could be going wrong that's stopping a patient from being able to conceive, right? Like that's something that happens all the time. And sorry, I'm going back to reproductive health again, but it's
It's
just an
fine.
example, whether it's if you have an issue with your blood pressure and it's ongoing and the doctor's not able to manage it, then they're going to potentially refer you to a specialist to manage that. Or, if your blood cell counts are elevated, they would, send you to a hematologist. Or, the specialists are there to pick up where the general practitioners leave off when they're not able to solve problems.
Yeah. And so just you talked about fertility, and I wanted to, you said in your experience that you actually, because of the aggressivity of your cancer, that you actually weren't able to conceive without
Hmm.
outside help. But so, and I know it was like 2007 and maybe people weren't talking about it as much, but fertility preservation was not something that anybody discussed with you.
No, it's something I had to bring up for sure. And when I did bring it up to my oncologist, the answer was sort of like, well, this was 2007 again. they don't freeze eggs. They don't do that. Like maybe somewhere in the States. Like he was like, what? And then I ended up making a few phone calls and figuring out that actually I could freeze my eggs at somewhere in Montreal.
Yeah.
And so I ended up going through that process. Unfortunately, it was also 2007 and egg freezing was very much so in its infancy. And unfortunately, those eggs didn't end up working, but I still was able to, have that hope, which was important to me at that time. And it also sort of shaped my career in a way because I ended up sort of veering into reproductive health after my cancer journey. So, yeah.
Do you want to talk about that a little bit?
I can talk about it. Which part did you want to talk about?
Well, I'm just curious about how your experience with cancer shaped I mean, I guess your whole life moving forward, and
Yeah,
specifically your
yeah,
professional life.
yeah. So I guess what after I went through that experience of having cancer, I was really shocked because I'm finding out about all these, I'm on Google for what Google was back then, finding out about all these different reproductive health options. And I you know, was shocked at how much the reproductive health community had advanced and in compared to what my doctor's knowledge was. And keep in mind, this isn't just a regular oncologist, this is a gynae oncologist. So someone who would have and he was the head of surgery at the Ottawa Hospital at the time and an incredibly knowledgeable, lovely man, but he didn't know very much about fertility preservation, right? So I thought to myself, if this is what a gynae oncologist that is this, you know, smart, intelligent, and elevated in his career knows, then I can't imagine what it's like in different oncology fields. So what I ended up doing is connected with the Reaper, I just sort of started calling people and I was like, I need to do something with this because it can't just be I had cancer when I was 24 and I lost my fertility and that's the end of the story. And I lived happily ever after. And I was like, my story, the reason I got cancer, I really wanted it to mean something. And for me, for something, you know, I wanted to take the lemon and I wanted to make some lemonade. And I was off work and I had undergraduate degree in business communications. And I'm like, there's got to be a way I can connect these two medical fields that seem to be working in silos away from each other and get them talking about fertility preservation for cancer patients, especially young cancer patients, because, back then, I can't believe I'm saying back then, but back then, you know, even though egg freezing was still very new, it was still an option. And then there was also the option of freezing your sperm if you were a male cancer patient and freezing embryos as well, right? So a woman could take her eggs and fertilize the eggs with a sperm donor or with her partner if she had a partner in her life and use those embryos later to have a child, especially if you're going through fertility treatments that are going to impact your fertility, right? So, or if you're going through cancer treatment that's going to impact your fertility. So, I ended up starting an organization called Fertile Future, which it still exists today, although in Ontario, because there is the Ontario funding program, it sort of works a little bit more outside of Ontario at this point. But what it does is it gets funding and medications to fertility or to oncology patients so that they're able to preserve their fertility. And it also provides a bursary to do so. So it brings what would normally be a very high cost down to a much more manageable cost for the patient. And then they're able to access fertility preservation quickly with the clinics, which is the majority of fertility clinics in Canada that are in the Fertile Future Network. So I was able to do that, establish it, do a lot of fundraising and get this fund going with some of the pharmaceutical partners. And it worked out really well. And I did that until I had my daughter through surrogacy and egg donation in 2011. So and then from there I moved into communications and consulting a lot in the healthcare fields and I have essentially done that ever since. So and I love it. I love it. I never took a science class in my life, but that's a lie. I took grade 9 science and paid grade 10 science actually, and paid as much attention as I needed to get a good grade, but it wasn't my passion. I was always like business, business, business. I'm going into business. And I fell in love with fertility and what we can do to help people grow their families in spite of not being able to have their family naturally on their own. And everything from egg freezing to third party reproduction, which is an industry term. I feel like everyone knows it, but it means conception with a third party. So like a donor, a surrogate. A donor could be an egg donor or a sperm donor. There's also embryo donation. So, I and then just in general, some of the amazing fertility treatments that we have now, where we're able to, someone can have a child that carries, as an example, the Huntington's disease gene. We're able to do PGTM testing and screen out those embryos, so they know that they're having a child who's not a carrier of that disease and won't have to deal with something that's maybe afflicted their family quite a bit, because it is a genetic related disease. So I love the fertility field. I also am very engaged in the oncology field, but I think that I really did find a home in the fertility field in a lot of ways, and I really do love the community and the camaraderie of that field. So I veered off and done a few different projects, but I always seem to come back to fertility. So
Yeah. Well, I think it's
yeah.
really important too, because we are seeing that younger and younger people are getting diagnosed with cancer. And so,
Yeah.
if they're not at a point where they're, with a significant other and or with a partner and want to have a family, it like that option is really important. And whether they're male or female, that option is really important. And
Exactly.
it's not something
Exactly.
that we were talking about like even 5 years ago. And, I was
No.
working in the melanoma space, and we were seeing like really young girls being diagnosed with really aggressive melanomas.
Hmm.
And,
Hmm.
they were in school and they were not thinking about having families. And so that
100%.
option, yeah, is really important.
100%. And egg freezing has come so far in the past 20 years. Like it's 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 a standard treatment now. Like freezing your eggs. We see I think the increase, I'm not even sure what it is, but it's I think it's like, I could tell you the stat, but where we had like in 20, I don't I can't even remember, in 2013 there was like 50 people freezing their eggs. In 2022 it was 1,500 people across Canada freezing their eggs, right? So we see a lot more people moving towards egg freezing because it has become a standard treatment, and it is something that's a very viable way to preserve your fertility, whether it's for medical reasons or socially, um, um, to have children later. Like it's a very common thing, and a lot more people are doing it, right? So I I love how far that's come as an option for women. And it's lovely to see something that's much more comparable to freezing your sperm, whereas before women only really had the option to experimentally freeze their eggs or get donor sperm and fertilize embryos and freeze those if they were single. So I love that. And the other thing that we haven't really talked about, though, is HPV, which is a big other passion of mine,
Wait,
right?
it's also on my list of questions to ask, so I'm glad that you brought it up.
Yeah, so I have since being diagnosed, I've advocated a lot for the importance of vaccinating for HPV, and raising awareness about cervical cancer, and how it is, essentially, the I mean, I have yet to see the stat of 100% of cervical cancer is caused by HPV, but I've seen as high as 90 something. So we
Mhm.
know that link is almost as strong as you can get in terms of science. HPV causes cervical cancer.
Yeah.
We can say that. And
Well, a specific strain of HPV causes cervical
oh,
cancer.
sorry, pardon me. There are most strains do not, but particularly 3, 4, 16, and 18 are, I know mine came from strain 16. And those are preventable now with the HPV vaccine. So
Yeah.
um, what I know is that we have a vaccine that prevents cancer. Take HPV out of it. Let's say there was no virus sexually spread or spread through sexual contact. Let's say there was a stomach flu that caused cancer. Would we, and there was a vaccine, and if you got that, the stomach flu wouldn't cause cancer. Would we want that vaccine? Yeah, we would. But people
Yeah.
get a little bit funny about this vaccine because it's related to a sexually transmitted infection.
Yeah.
And what we do know is that 3/4 of the population at least carries or has an HPV infection at some point in their life. And the majority of those people are able to fight it off without knowing they ever had it.
Got it.
But a small percentage of those people will develop precancerous or cancerous cells in response to the vaccine. I've seen some information saying it takes a long time. For me, it did not take a long time because I became sexually active quite late in life and developed cancer quite quickly. So I feel that you know, the HPV vaccine is something that hasn't been, the uptake in Canada has not been as good as we had hoped. Where we see countries like Australia saying they're going to be able to eradicate cervical cancer by 2028, I've seen, I think.
I
Um,
don't know.
I've seen 2028, I believe. And Canada is not on track to eliminate by 2040.
Yeah.
So when you think about where people are at with this vaccine, and we see it in school age children, that there is a public program to facilitate this vaccine, and there are people that say no to the HPV vaccine, and they just don't understand the science behind it. And there is a stigma with it, but we really, in order to save lives, we need to stop feeling stigmatized because this is a sexually based infection, and we need to start focusing on the fact that we have a vaccine that prevents cancer, period.
Yeah. Yeah. And I think it's really important too to talk about like cervical cancer is a woman's disease or a women's cancer, but HPV is not just like a woman doesn't just get HPV on her own. So it's really important that both girls and boys are getting the HPV vaccine. And the other thing that I wanted to mention was that, and I think we talked about it offline, in Scotland, they actually eradicated all cervical cancers caused by the HPV vaccine. And I think that's really important to talk about because I know that
Yeah.
there, and I received comments on my Instagram when I posted about this, like, why are you promoting vaccination? You have to be able to separate from the pandemic and like a HPV vaccine.
100%. Like it's, the pandemic had a negative impact on our HPV vaccination rates. So
Hmm.
prior to the pandemic, the rates of vaccination were much higher than they have been since the pandemic. And there is a negative feeling towards, vaccines right now. The culture or there is a bit of a push for people to feel to not vaccinate or to be skeptical of vaccines. And what we need to remember is that we've eradicated diseases by using vaccines. And
Diseases that are now back, like
yeah, like
measles.
measles, right? And like look at polio. Like there's so many vaccines are incredible tools to help people not get sick that would never know they would have gotten sick had they not gotten the vaccine, right? So that's the thing. We're saving people's lives through vaccinations that don't know that we're saving their lives because they never end up getting the disease.
Exactly.
And that's incredible. And what we have to do is circle back to um, knowing and knowing that we're able to cure diseases and give people better lives because of them. And it's really unfortunate the state of where people are at with I would say the temperature of the attitude on vaccines right now, and it's really is something that we need to work on and try to change, because it I think of all the lives that aren't being saved. I think of all the women who were recently diagnosed with cervical cancer because they weren't able to go to screening appointments during the pandemic, and will be diagnosed because their parents did not get them the vaccine. And I know that sounds awful, and it's not just cervical cancer though. It's oral cancers. It's anal cancers. There's a multitude of other cancers that are caused by HPV as well, and we have to remember that you won't know who if if you get your child the vaccine, you won't know if their life was saved. But if you don't, you will definitely know if they get cancer.
Yeah.
And you won't be pleased with yourself for not having vaccinated them, because it will change their lives.
Yeah.
And I can tell you that as someone who went through what I went through at age 24, the treatment is incredibly invasive. It's demoralizing. Having to have people, I can remember teams of medical students coming in with doctors, and I was having an issue post-surgery, and they were trying to figure out, why my bladder wasn't working after one surgery. It didn't work for 10 weeks afterwards, and I had to wear a catheter. And they were doing this one test on me, and all these to be urologists came into the room, and they were my age. Like, I was looking at them and I was like, oh my God, like, you're the doc, like, you're my age. And I'm in an exam room, and everyone's seen, like, it was just awful. It was awful. And it just felt so unfair. And I I don't want any woman to have to go through that journey. I can remember getting needles in areas and things, getting ready for tests because I had to get radiation fluid put in me for a test to see where the cancer was. And it was just all so painful and awful. And I wouldn't wish it on anyone, like anyone. And I just don't. For every time I tell my story, if I'm telling one woman who gets the vaccine and then doesn't get cancer, then it was worth it, right? And I don't want someone to have to go through that. It was certainly a big moment for me when my daughter got her first HPV vaccine this year, because I get to know that, like, she's not gonna have to live that journey. And as
Yeah.
much as it shaped who I am, and there's ways I'm grateful for it, would I have chosen it? No,
Yeah.
right?
Exactly.
Yeah, yeah.
So are any last thoughts that you would like to share, or
Just, you know, I'm going to circle back to healthcare in general for all people. Manage it like you manage anything, and how you manage your job, you, if you are in a job and you plan meetings, look, and you go into your meeting and you have an agenda of things you want to talk about, manage your healthcare the same way.
Mhm.
Like, go into your appointments with a list of things, even if you think they're nothing, that's it could be something. And if you're on top of your healthcare, you're going to live a longer life and you're going to have a better quality of life.
Yeah.
And it's at some point, everyone has an issue that comes up, and a lot of times, if early detection, like the majority of times, leads to better outcomes. And I've saw too many women, especially, tell the story, especially with cervical cancer, where they left something too long. And then by the time they were diagnosed, they were stage 3, they were stage 4, and they're not here with us anymore. And that can happen with any type of disease. And earlier intervention makes for better outcomes. And manage your health care. Otherwise, you could be on the other side of uh, a condition that changes your life or ends your life that you didn't need to have, and that didn't need to get so bad. You give yourself the respect to manage your health care and to manage your health in a proactive way.
Yeah. That's great advice. And so the other women that I spoke to, doing this Her Health program. I found it on social media, but you I found on LinkedIn, and I don't know if you connect with women, if you share your story on socially or on social platforms, but if somebody wanted to connect with you, is there a way that they could do that? Are you,
Yeah, like I have an
even with the
open Instagram profile. I am Liz Elwood. So you can come follow me, send me a message. Anyone wants to connect with me, I'd be more than happy to chat or, you know, support another woman who has been through a difficult journey or it might be embarking on one. And I would just say that, you know, I I have shared my story a lot. I've done it on social media. I have done it on different platforms for different campaigns and related to Canada versus HPV and Vaccines Canada and things like that. Um, I feel so strongly that um, also, another really great thing that I think is really important if you're having a healthcare issue and you're even debating talking to your doctor about it, talk to another woman about it. Like, see what their take is on whether or not you should go to a doctor. Because if you're having feelings that you should like, what would you tell your best friend to do? What would you tell your mom to do? What would you tell your sister to do?
yeah,
Do that for yourself. You deserve that.
yeah, I agree. That is so important.
Yeah, 100%.
So thank you, Liz. I will put your handle in the description for the conversation. So anybody who wants to reach out to you or, wants to get more information even about the fertility preservation and the
Yeah,
fertility future.
absolutely.
Yeah.
I'd be happy to have a chat. Absolutely. And just in general, I think, oh my gosh, I know we're ending this, but I was just going to go on a mini tiny rant about women and fertility.
Go for
Uh,
it.
okay, just really quickly, you don't even have to include it if you don't think it's important, but I was just going to say that, women, we're taught a lot in schools how to not get pregnant. More often than not, we see people coming through fertility clinics because they think that, they've maybe waited too long trying to conceive. You shouldn't be trying for more than 6 months to conceive without, being able to. If you are, then you should be talking to your doctor. But more importantly, just, you know, even though, celebrities like, um, Gwen Stefani and Halle Berry and are having children into their 40s, it doesn't mean that they're having them naturally, and it certainly doesn't mean that they're having them with their own eggs. Like I don't not to say that they didn't, but it doesn't necessarily mean it. So don't think that you're going to be able to stop your career when you turn 40 and automatically get pregnant. It's not that likely to be honest. Like
Yeah.
the percentages are quite low. So if you think you want a family, look into your fertility earlier because you might be really glad you did. It might be something that you're not able to leave for as long as you think.
Yeah. And just like your business meeting, think about your fertility early because if
Absolutely.
obviously the quality of your eggs are better the younger that you are. And so like if you're starting your career and you don't know
Hmm.
when you're going to be at a point where you're ready to have a family, it's always best to do
Absolutely.
it early.
And more companies have fertility benefits now, and insurance programs cover medications and things like that. And there is the public funding program for fertility treatments as well. So there's a lot of options out there to help patients financially as well.
Yeah. I think, I know we said we are going to end, but you talked about something that sparked something else that I had on my question list. And you talked about how the healthcare system was really siloed. And I think, we talk about women's health, and actually it shouldn't be a silo within healthcare. We should just, you know, be in healthcare.
Mm-hmm, mm-hmm, mm-hmm. And that's where I think sometimes the role of a patient is so important because they often find the silos and the disconnects in the healthcare system and point them out to the right professionals. So the role of the advocate within the healthcare system is not something that I think sometimes is not given the level of importance that it needs because, you know, ultimately, the heart surgeon who is on 10 committees isn't going to take the time to talk to the, oncologist who is trying to get through treating 200 patients at the same time. And like they're busy, they're really busy, and they're just simply not talking to each other. And the only way to identify the gaps in the healthcare system where there are links, where like the two fields could be somehow linking together, it it was a patient advocate. Look what happened with me in fertility and oncology, right? I
Yeah.
was like, why are you guys not talking to each other? And then once I did, it became, a connected field in Canada. And that's an example of how a patient advocate was able to come in and help a whole bunch of patients who were able to benefit from that in the future. And we need to really concentrate on making those connections between medical fields, because we're able to ensure a better quality of life for patients and better patient outcomes.
Yeah, and I think that's actually also something really important that you're bringing up, because I know I've spoken to a lot of people who were patients and are now like in that space where they like this is their passion and they want to make this their profession and
Hmm.
they don't necessarily know how to do that. I think
Hmm.
like you found a really successful way to do it, like with your professional expertise and your lived experience, like you saw this gap and you built that out.
Yeah, I mean, there's certainly been highs and lows, right? But I think, most of my work is, very based in marketing, communications, business development. The advocacy work is volunteer, right? So it's very rarely do I, even when I have been involved in projects where there's y- a professional, if I've ever, if I've never taken money for my advocacy, let's put it that way. I have done work related to projects, but very seldomly, if I'm being honest. Advocacy is just a passion, and it's I don't know how someone would actually make a career out of it, other than, you know, if they were to form an organization and build that out and build a company and link the two like I did with Fertile Future. But I think that you just start somewhere, and if you have a vision, just do the first step, and then do the second step, and then do the third step, and then the picture will become clearer, and all of a sudden you're able to build it and turn it into something. And if you're passionate about something and you're sharing that passion with other people, and you're saying, I want to do this thing to help other people for good, and will you help me? I don't think people want to say no to that, right? Like most people are good and want to do good and want their work to amount to something at the end of the day. And if you come to someone and you have a plan and you speak passionately, they're gonna, and you ask for a very specific thing like an introduction, or some advice or whatever you're asking for, they're likely going to help you in whatever capacity they can. So just take the first step and see where it leads you.
I like that. Just take the first step.
Exactly. That's all you have to do. Don't boil the ocean. Just take the first step and then take the second step. Don't look at the whole, don't look at the whole mountain. Just take one step at a time, because
Yeah.
you have to start somewhere. If nothing happens overnight, and everyone, you know, has the ability to make something, to build something that they want to build. So it have the confidence and believe in yourself and take the first step.
Yeah. Perfect. Thank you so much, Liz.
You're welcome, hon. It was great to talk to you.
It was great talking to you too.